Sleep apnea. When many people hear this term, they immediately think of the same thing: snoring at night, and having to sleep with a mask on their face. But sleep apnea is much more than that. Sleep apnea is a serious sleep disorder where breathing repeatedly stops and starts during sleep. In some people, these pauses can happen dozens or even hundreds of times in a single night. This doesn't just affect sleep quality, it directly impacts daily life. Poor and fragmented sleep can weaken attention, thinking, and decision-making. Reaction time slows down. The risk of mistakes increases. In some cases, people may even feel drowsy while driving. Sleep apnea also affects many systems in the body. When breathing stops, oxygen levels in the blood drop. The body responds with a stress reaction. Hormones like adrenaline are released. These increase heart rate and blood pressure. Over time, this places extra strain on the heart and blood vessels. There are two main types of sleep apnea. The most common is obstructive sleep apnea. In this type, the soft tissues in the throat relax during sleep and narrow the airway. When airflow is blocked, breathing temporarily stops. This is often noticed through snoring, sudden pauses in breathing, or gasping sounds. The second type is central sleep apnea. In this case, the issue is not the airway. Instead, the brain does not send proper signals to the muscles that control breathing. This type is less common. When people think about treatment, one method usually comes to mind: machines that use a mask. These devices have been considered one of the most effective treatments for many years. They deliver a steady flow of air into the airway. This gentle pressure helps keep the airway open. As a result, breathing interruptions are significantly reduced. Many people who use this treatment experience fewer breathing pauses, less daytime sleepiness, and improved quality of life. But treatment options are not limited to this. In some cases, other methods may be used. For example, oral appliances. These are special devices worn in the mouth that move the lower jaw slightly forward. This helps keep the airway open. This option is often preferred for mild sleep apnea. In certain situations, other technologies may be considered. For example, a small implanted device. This device stimulates nerves related to breathing and helps keep the airway open. This approach is usually considered for people who meet specific criteria. Surgical options also exist. Some procedures remove excess soft tissue from the back of the throat to widen the airway. In other cases, the upper and lower jaw are repositioned forward. This creates a more permanent increase in airway space. Not every surgical option is suitable for everyone. The choice of treatment depends on several factors: the type of sleep apnea, its severity, the person's anatomy, and overall health. That's why the most appropriate approach is to evaluate options with a healthcare professional. Sleep apnea is often seen as just a snoring problem, but in reality, it's a condition that affects sleep quality, daily performance, and overall health. With proper diagnosis and appropriate treatment, sleep quality can improve significantly, and this improvement is often felt in many areas of daily life. This is Aging Made Simple. In a world where misinformation spreads quickly, we focus on clear, reliable, science-based health insights. This content is for informational purposes only and is not a substitute for professional medical advice. If you want to make more informed decisions about your health, consider subscribing and following the channel. See you in the next video. Stay well.